Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, here we are discussing previous year ESIC questions. Two parts already be completed, anatomy and physiology. And here in this video again we can see same previous year ESIC questions. Surely this question will helpful for your coming exam. First question, unpleasant awareness of one's own heartbeat is called. This question from ESIC exam 2016. Options: option A bradycardia, option B dyspnea, option C tachycardia, option D palpitation. Unpleasant awareness of one's own heartbeat is called palpitation. Option D is the correct answer. First option, bradycardia means decreased heart rate. Tachycardia means increased heart rate. Dyspnea means difficulty in breathing. Our question, unpleasant awareness of one's own heartbeat is known as palpitation. The next question, appropriate needle size for insulin injection is. This question also from ESIC exam 2016 question paper. And the option we can see, first option 18 gauge with 11 by 2 inch long. Option B 22 gauge 1 inch long. Option C 22 gauge 11 by 2 inch long. And option D 28 gauge 5 by 8 inch long. Correct answer is option D 28 gauge 5 by 8 inch long. Insulin injections are giving in subcutaneously. So the injection needle size for the subcutaneous injection is 25 to 28 gauge, 1 by 2 to 5 by 8 inch length. Okay, here 28 gauge, 5 by 8 is there. So that is the correct answer. Remaining intradermal injection, intramuscular injection, intravenous injection size, needle size also important. That also you have to go through once. Intradermal means 26 or 27 gauge with 3 by 8 to 5 by 8 length. That is intradermal. Intramuscular means 21, 22, 23 gauge. 23 gauge needle with 1 to 2 inch length. Intravenous means 18 to 21 gauge needles with 1 to 2 inch length. Okay, our question is insulin injection subcutaneous route. So that is option D. The next question, which one of the following is correct with regards to meaning of the term hyperkalemia? Options, option A increased blood sugar level, option B increased blood cholesterol level, option C increased potassium level, option D increased urine sodium level. Hyperkalemia means increased potassium level, serum potassium level, that is hyperkalemia. Normal serum potassium level is 3.5 to 5.1 milliequivalent per liter. That is important point, 3.5 to 5.1 milliequivalent per liter. The next question, catgut is preserved in. Options, option A glutaraldehyde, option B isopropyl alcohol, option C iodine, option D formaldehyde. Catgut is preserved in isopropyl alcohol. Option B is the correct answer. Usually this catgut is preserved in alcohol-based solution. For example, ethanol or isopropanol or isopropyl alcohol. The next question, which of the following term describes a fungal infection in the scalp? Options, option A tinea corporis, option B tinea capitis, option C tinea pedis, option D tinea crucis. And the correct answer is option B tinea capitis is the fungal infection of the scalp. Tinea corporis means it's a superficial infection of the skin and legs. Tinea pedis means it's a athlete foot. Tinea crucis means it's a fungal infection of groin. The next question, which anti-tubercular drug is not given to a HIV positive patient? Options, option A pyrazinamide, option B rifampicin, option C ethambutol, option D isoniazid. Correct answer is option B rifampicin. Usually, the rifampicin is an enzyme inducer. It can able to decreases the efficiency of the drug which is using for HIV. For example, nevirapine. It will decreases the action of this nevirapine. So, we are not giving rifampicin to HIV positive patients. The next question, fear of speaking in public is known as options. Option A, gamophobia. Option B, glossophobia. Option C, gynophobia. Option D, claustrophobia. Fear of speaking in public is known as glossophobia. Option B is the correct answer. The next option, gamophobia, first one option, that is fear of marriage. And option C, gynophobia, means fear of woman. And option D, claustrophobia, means fear of confined spaces. Okay, here fear of speaking in public is known as glossophobia. The next question, androgen binding protein is secreted by options. Option A, pituitary gland. Option B, liver. Option C, Sertoli cells. Option D, Leydig cells. Androgen binding protein is secreted by option C, Sertoli cells. This androgen binding protein is a glycoprotein which is secreted by the Sertoli cells of seminiferous tubules. Okay, option C is the correct answer. Move on to the next question. The purpose of peritoneal dialysis is options. Option A, re-establish kidney function. Option B, clear the peritoneal membrane. Option C, provide fluid for intracellular space. Option D, remove toxins and metabolic waste. Purpose of peritoneal dialysis is to remove toxins and metabolic waste. Option D is the correct answer. The next question, the nurse is evaluating the client response to hemodialysis. Which lab value would not reflect changes from the hemodialysis? Options, option A, serum creatinine levels. Option B, dissolved pressure of carbon dioxide. Option C, serum potassium level. Option D, hemoglobin level. Here, the nurse is evaluating the response after hemodialysis, okay, for a patient. So, after hemodialysis, which lab value will not change? That is the question. So, correct answer is option B, dissolved pressure of carbon dioxide. Okay, so after hemodialysis, the serum creatinine level will be decreased. Okay, and serum potassium level also will decrease and hemoglobin level will be changed. That is, may increase or decrease. But dissolved pressure of carbon dioxide will not change. Option B is the correct answer. Move on to the next question. A light rays entering the eye is controlled by options. Option A, pupil. Option B, iris. Option C, cornea. Option D, lens. Correct answer is option A, pupil. Light rays which is entering the eye is controlled by pupil. Move on to the next question. Which is the most important test the nurse should check to determine whether the transplanted kidney is working? Option A, WBC count. Option B, serum creatinine levels. Option C, renal ultrasound. Option D, 24 hours urine output. In order to know the transplanted kidney is working as a nurse, what we have to check after the transplantation? So, correct answer is option B, serum creatinine level. Okay, option B is the correct answer. Move on to the next question. A client who just had a kidney transplant is transferred from the post-anesthesia care unit to the ICU. The nurse is in the ICU should monitor the urine output every. The question is, a patient is transferred from the post-anesthesia care to ICU after kidney transplantation. So, in the ICU nurse should monitor the urine output that is the question. So, correct answer is every hour. Option B is the correct answer. Here, after kidney transplantation, as a nurse, we have to monitor the urine output hourly, and the urine will start to form as soon as the donor is leaving. Okay, so we have to check the urine output hourly, and if the urine output is less than 100 ml per hour means we have to inform it. The next question, the eyeball is approximately spherical in shape with a diameter of about option A 1.8 cm, option B 3 cm, option C 1 cm and option D 2.3 cm. And the correct answer is option D 2.3 cm. The diameter of eyeball is approximately 2.5 cm. Here option 2.3 is there, so that is the correct answer. The next question, size of pupil varies between option A 3 to 5 mm, option B 2 to 6 mm, option C 1.5 to 8 mm and option D 1 to 10 mm. Size of pupil varies between. Correct answer is option C 1.5 to 8 mm. The average diameter of pupil is about 4 to 5 mm, but its size varies from 1 to 8 mm. Okay, here pupil size varies. That is the question. So 1.5 to 8 mm. The next question, herpes zoster is a common disease caused by option A blood disorder, option B nerve disorder, option C viral infection, option D unhygienic skin infection. Herpes zoster is a disorder, common disease caused by viral infection. Option C is the correct answer. Herpes zoster is an inflammatory disease of the skin caused by varicella zoster virus. Move on to the next question. Group of increased risk of herpes zoster is. Options, option A pregnant woman, option B patient with atopic dermatitis, option C infant with congenital infection, option D persons at advanced age. Here correct answer is option D persons at advanced age. During old age, the immunity power will be less, so infections also will get easily. Here, the persons at advanced age will get herpes zoster infection. This herpes zoster is a viral infection caused by varicella zoster. It is mostly affecting the persons at advanced age. The next question, in psoriasis, main clinical manifestation is options, option A blue spot on the skin, option B ecchymosis, option C dry shining scaly lesion, option D large vesicles. Clinical manifestation, main clinical manifestation of psoriasis is dry shining scaly lesion. Option C is the correct answer. Move on to the next question. Defense mechanism seen in schizophrenia is. It's a very important question. Option A displacement, option B repression, option C projection, option D regression. Defense mechanism seen in schizophrenia is option C projection. First option displacement is there. In phobia, the defense mechanism seen in phobia is displacement, and the defense mechanism seen in neurosis is repression, and the defense mechanism which is seen in neurosis is regression. Here question is in schizophrenia it is projection. Option C is the correct answer. Move on to the next question. Uppsc point is. Options, option A C4 C5, option B C5 C6, option C C6 C7, option D C7 C8. Uppsc point is option B at C5 and C6. So far we discussed ESIC previous year question papers. Again I can bring more questions in coming videos. Thank you for watching my channel. If it is useful for your studies, please subscribe my channel.